Could the pills you take every day be silently destroying your memory? What if I told you that some of the most common medications, ones that millions of seniors rely on, could be increasing your risk of dementia? Sounds alarming, right? But the truth is, research has linked certain prescription and over-the-counter drugs to cognitive decline. And the worst part? Most people have no idea. Dementia is on the rise, and while aging is a natural risk factor, what if something else is fueling this epidemic? What if the very medications meant to help you are instead harming your brain? Many seniors dismiss memory problems as just getting older. But what if memory loss, confusion, or brain fog is actually caused by a medication sitting in your medicine cabinet right now? This is not just speculation. It's backed by science. Several widely used drugs, including some for allergies, anxiety, pain relief, and even sleep, have been linked to an increased risk of cognitive decline. Some affect brain chemicals, while others interfere with memory formation. If you or a loved one takes medication regularly, it's crucial to understand how it might be affecting your brain health. But here's the good news. Knowledge is power. Today, we're exposing 8 medications that have been scientifically linked to dementia. We'll break down how they impact your brain, the risks they pose, and what you can do about it. And don't worry, it's not about quitting essential medications overnight. Instead, we'll talk about smarter, safer alternatives that protect your memory while managing your health. Stick with me until the end, because some of these medications are so common, you probably have them in your home right now, ready to find out which drugs you should be cautious about. Let's dive in. Anticholinergics. The hidden memory killers. Anticholinergic drugs are commonly used to treat allergies, colds, overactive bladder, and even motion sickness. Medications such as Benadryl, diphenhydramine, oxybutynin, used for bladder control, and certain antidepressants fall into this category. While these drugs can be effective for their intended purposes, they pose a serious hidden risk to brain health by interfering with acetylcholine, a neurotransmitter crucial for memory and cognitive function. Acetylcholine plays a vital role in learning, memory, and communication between brain cells. When anticholinergic medications block this neurotransmitter, the immediate effects can include drowsiness, confusion, and difficulty concentrating. However, the real concern lies in long-term use. Repeatedly blocking acetylcholine can lead to lasting damage to memory and thinking abilities, potentially accelerating cognitive decline. Research has shown that low levels of acetylcholine are a hallmark of Alzheimer's disease, meaning that prolonged use of these drugs may significantly increase dementia risk. Scientific studies have provided strong evidence of this link. A study published in JAMA Internal Medicine tracked over 3,400 seniors for more than a decade and found that regular use of anticholinergic medications was associated with a 54% higher risk of developing dementia. Alarmingly, the risk increased with prolonged use. Another large-scale study from the University of Nottingham analyzed 280,000 medical records and confirmed that even low doses taken over time were linked to cognitive decline. Many people unknowingly take anticholinergic drugs without realizing the potential harm. Some of the most common ones include allergy medications like Benadryl, diphenhydramine, bladder control drugs like oxybutynin, ditropan, certain antidepressants like amitriptyline, Elavil, and motion sickness medications like scopolamine. If you or a loved one takes any of these medications regularly, it is important to speak with a doctor about possible safer alternatives or natural remedies. Reducing or replacing anticholinergic medications early on can help protect cognitive health and lower the risk of dementia in the future. Benzodiazepines, the brain fog. Inducers benzodiazepines, commonly prescribed for anxiety, insomnia, and seizures, include well-known drugs like Xanax, alprazolam, Valium, diazepam, and Ativan, lorazepam. While these medications can be effective for calming the nervous system, they come with a serious downside. They may contribute to cognitive decline and increase the risk of dementia. These drugs work by enhancing the effects of gamma-aminobutyric acid, GABA, a neurotransmitter that slows down brain activity. This is why benzodiazepines help with anxiety and sleep problems, as they have a sedating effect that relaxes the brain. However, over time, this suppression of brain activity can lead to memory loss, confusion, and impaired thinking, especially in seniors. Studies have shown a strong link between long-term benzodiazepine use and dementia. Research published in the BMJ, British Medical Journal, found that older adults who took benzodiazepines for extended periods had a 50% higher risk of developing Alzheimer's disease. Similarly, a study in JAMA Psychiatry revealed that even low doses used over a long period were associated with cognitive decline. The longer someone takes these medications, the greater the risk of memory impairment. 2. Reduce the risks. It's important to explore safer alternatives for managing anxiety and sleep disorders. Non-drug treatments such as cognitive behavioral therapy, CBT, relaxation techniques, and lifestyle changes can be highly effective. If you or a loved one are using benzodiazepines regularly, speak with a doctor about tapering off the medication safely and finding better long-term solutions for mental and cognitive well-being. Statins, cholesterol-lowering drugs, and their impact on brain health. Statins are among the most commonly prescribed medications for lowering cholesterol and reducing the risk of heart disease and stroke. These drugs, including Lipitor, atorvastatin, Crestor, rosuvastatin, and Zocor, simvastatin, work by blocking an enzyme in the liver that produces cholesterol. By decreasing levels of bad LDL cholesterol, statins help prevent the buildup of plaque in arteries, reducing the chances of heart attacks and strokes. For many seniors, these medications are considered a lifeline, especially those with existing cardiovascular issues. However, despite their benefits, there is growing concern about their potential effects on brain health and cognitive function. One major controversy surrounding statins is the possibility that they may interfere with brain cholesterol levels, which are essential for cognitive function. The brain contains a high concentration of cholesterol, which plays a critical role in maintaining cell structure, supporting neurotransmitter activity, and facilitating communication between neurons. Some researchers worry that because statins reduce cholesterol levels in the body, they may also reduce cholesterol in the brain, potentially leading to memory loss, confusion, and cognitive decline. Reports from statin users have included symptoms like forgetfulness, difficulty concentrating, and mental fog, raising questions about whether these medications could contribute to dementia or Alzheimer's disease in older adults. Scientific research on this issue is mixed. Some studies suggest that statins might actually have neuroprotective properties, reducing inflammation, improving blood flow, and lowering the risk of stroke, all of which contribute to better brain health. There is also speculation that statins could help reduce the risk of Alzheimer's disease by preventing plaque accumulation in the brain, similar to how they prevent arterial plaque buildup. However, other studies suggest that long-term statin use may increase the risk of cognitive decline, particularly in seniors. In 2012, the FDA issued a warning that some statin users reported short-term memory problems, though these issues were often reversible after stopping the medication. Despite these findings, there is no clear consensus on whether statins help or harm brain function, making it difficult for seniors to determine whether the benefits outweigh the risks. If you are currently taking statins and are concerned about cognitive effects, it is crucial to talk to your doctor before making any changes. Stopping statins abruptly can increase the risk of heart complications, so any adjustments should be made under medical supervision. Your doctor may recommend modifying your dosage, switching to a different statin, or exploring alternative cholesterol-lowering strategies to balance heart and brain health. For those looking to reduce reliance on statins, adopting heart-healthy lifestyle changes can be an effective alternative. A Mediterranean-style diet, rich in healthy fats, fiber, and antioxidants, can naturally help regulate cholesterol levels. Regular exercise, stress reduction techniques, and proper blood sugar control also play a key role in maintaining cardiovascular and cognitive health. While statins can be beneficial for many people, combining them with holistic lifestyle approaches may offer a more balanced strategy for protecting both heart and brain function as you age. Sleep aids, the hidden danger to brain health. Many seniors struggle with sleep issues, whether it's difficulty falling asleep, staying asleep, or waking up too early. To combat insomnia, many turn to over-the-counter or prescription sleep aids like Ambien, Zolpidem, Lunesta, Ezopiclone, and Tylenol PM, which contains diphenhydramine, the same ingredient found in Benadryl. While these medications can provide short-term relief, they come with serious risks, particularly when it comes to brain health and memory function. One of the biggest concerns with sleep aids is their impact on cognitive function. Many of these medications work by slowing down brain activity, which may help induce sleep, but can also lead to morning grogginess, brain fog, and confusion. This is especially concerning for seniors, as studies show that long-term use of sleep medications can lead to memory problems, impaired thinking, and even an increased risk of dementia. In fact, some sleep aids, particularly those classified as benzodiazepines, such as Valium, Xanax, and Ativan, have been directly linked to cognitive decline and an increased risk of Alzheimer's disease. Scientific research supports these concerns. A 2015 study published in JAMA Internal Medicine found that older adults who regularly used sleep aids containing diphenhydramine or benzodiazepines had a significantly higher risk of developing dementia. Another study in the British Medical Journal revealed that individuals who took benzodiazepines for extended periods had a 51% greater chance of developing Alzheimer's disease compared to those who didn't. Researchers believe that these medications may disrupt normal sleep cycles, interfere with brain detoxification processes, and contribute to long-term neurological damage. Given these risks, seniors should consider natural sleep solutions before turning to medications. Melatonin, a hormone naturally produced by the body, can help regulate sleep-wake cycles and is often a safer alternative to prescription drugs. Magnesium, known for its calming effects, can help relax the nervous system and improve sleep quality. Establishing good sleep hygiene is also crucial. This includes keeping a consistent bedtime, reducing screen exposure before bed, avoiding caffeine late in the day, and creating a relaxing nighttime routine. If you are currently taking sleep aids and are concerned about their effects, speak with your doctor about alternative options. Gradually reducing dependence on these medications while incorporating natural sleep strategies may help protect both your cognitive function and overall well-being in the long run. Remember, good sleep is essential for brain health, but the way you achieve it matters just as much. Antidepressants, the hidden risks for seniors. Brain health depression is a serious concern for many seniors, and it's no surprise that antidepressants are among the most commonly prescribed medications. For older adults, drugs like Prozac, fluoxetine, Zoloft, sertraline, Lexapro, escitalopram, and Paxil paroxetine belong to a class of antidepressants called selective serotonin reuptake inhibitors, SSRIs. While these medications can be life-saving for individuals struggling with severe depression, they are not without risks, especially when it comes to cognitive function and brain health. One of the main concerns with antidepressants is their potential to cause cognitive dysfunction, confusion, and memory problems in seniors. Some studies suggest that long-term use of antidepressants may be linked to an increased risk of dementia. This is because SSRIs and other depression medications alter neurotransmitter levels in the brain, affecting mood regulation but also possibly interfering with learning, memory, and mental sharpness. Additionally, older adults metabolize medications more slowly, which means that antidepressants can accumulate in the system, leading to stronger and prolonged side effects such as drowsiness, dizziness, and mental fog. Scientific research highlights these risks. A 2017 study published in the American Journal of Geriatric Psychiatry found that seniors taking certain antidepressants, particularly tricyclic antidepressants and SSRIs, had a higher likelihood of cognitive impairment. Another study from the Journal of Clinical Psychiatry suggested that long-term SSRI use was associated with faster cognitive decline in individuals over the age of 60. Some researchers also believe that antidepressants may disrupt the natural balance of neurotransmitters in the brain, leading to neurological side effects that mimic early dementia symptoms. So, what can seniors do instead? While antidepressants may be necessary for individuals with severe or persistent depression, it's important to explore non-medication approaches first, especially for mild to moderate depression. Therapy, particularly cognitive behavioral therapy, CBT, has been proven to be just as effective as medication for many individuals struggling with depression. Regular physical exercise, even light activities like walking, stretching, or yoga, can boost mood-enhancing neurotransmitters like serotonin and dopamine, reducing depression symptoms naturally. Diet also plays a huge role. Foods rich in omega-3, fatty acids found in salmon, walnuts, and flax seeds, leafy greens, and antioxidants have been shown to support brain health and improve mood. If you or a loved one is currently taking antidepressants, it's important to have an open conversation with your doctor about the risks and benefits. Never stop taking medication abruptly, as this can lead to withdrawal symptoms and worsening depression. Instead, work with a healthcare provider to explore gradual adjustments and alternative strategies to support mental and cognitive health in the long run. Protecting your brain while managing depression is possible. It just requires the right approach. Antipsychotics, a hidden threat to brain health in seniors. Antipsychotic medications such as Risperdal, Risperidone, Seroquel, Quetiapine, Zyprexa, olanzapine, and Haldol, haloperidol, are primarily prescribed for conditions like schizophrenia, bipolar disorder, and severe depression. In some cases, doctors also prescribe them off-label to manage agitation, aggression, or hallucinations in dementia patients. While these medications can help control severe psychiatric symptoms, they come with serious risks, especially for seniors. One of the biggest concerns with antipsychotic medications is their effect on neurotransmitters like dopamine and acetylcholine, which are crucial for cognition, memory, and mental clarity. By blocking these neurotransmitters, antipsychotics can lead to brain fog, drowsiness, confusion, and even accelerated cognitive decline. Research has shown that long-term use of antipsychotics in seniors can significantly increase the risk of dementia. A 2018 study published in JAMA Psychiatry found that individuals taking antipsychotic medications had a higher risk of developing dementia compared to those who did not. Another large-scale study conducted in the UK revealed that seniors prescribed antipsychotic drugs for behavioral symptoms of dementia experienced faster cognitive decline and a greater likelihood of premature death. The FDA has even issued a black box warning on antipsychotic medications, cautioning that their use in elderly dementia patients is associated with an increased risk of death due to complications like strokes and infections. Because of these risks, it is essential for seniors and their caregivers to carefully evaluate whether antipsychotics are necessary. In some cases, non-drug alternatives may be safer and more effective. For example, behavioral therapy, social engagement, and structured Routines can help manage agitation and aggression in dementia patients without resorting to medication. If an antipsychotic is prescribed, it should be used at the lowest effective dose for the shortest duration possible and closely monitored by a doctor. If you or a loved one is currently taking an antipsychotic, speak with your healthcare provider about alternative options. In many cases, adjusting lifestyle factors, incorporating brain-boosting foods, engaging in regular physical activity, and practicing stress management techniques can help improve mental well-being without the harmful effects of these medications. Always remember, your brain health is too important to take unnecessary risks. There are often safer ways to support your mental and emotional well-being. Proton pump inhibitors. Could your acid reflux medication harm your brain? Proton pump inhibitors, PPIs, are a commonly prescribed class of medications for acid reflux, heartburn, and GERD, gastroesophageal reflux disease. Some of the most well-known PPIs include Nexium, esomeprazole, Prilosec, omeprazole, and Prevacid, lansoprazole. These drugs work by reducing stomach acid production, providing relief from symptoms like heartburn, indigestion, and acid regurgitation. While they are effective for short-term relief, many seniors take PPIs for months or even years, leading to serious health risks, including potential brain damage. One of the biggest concerns with long-term PPI use is its impact on vitamin B12 levels. Stomach acid plays a crucial role in absorbing vitamin B12 from food, and when PPIs suppress acid production, B12 absorption decreases. Vitamin B12 is essential for brain function, nerve health, and red blood cell production. A B12 deficiency can lead to symptoms like memory loss, confusion, depression, and even permanent nerve damage. Scientific research has found a strong link between PPIs and cognitive decline. A 2016 study published in JAMA Neurology found that long-term PPI users had a significantly higher risk of developing dementia compared to those who did not take these medications. Another study from Germany's University of Bonn discovered that PPIs may promote the formation of toxic beta-amyloid plaques in the brain, which are linked to Alzheimer's disease. Additionally, some research suggests that long-term PPI use may contribute to brain shrinkage, further increasing dementia risk. So, what can seniors do to manage acid reflux without the risks associated with PPIs? First, dietary adjustments can make a huge difference. Avoiding acidic foods, spicy meals, caffeine, and alcohol can help reduce reflux symptoms. Eating smaller meals, not lying down immediately after eating, and maintaining a healthy weight can also improve digestive function. Natural remedies like ginger tea, aloe vera juice, and apple cider vinegar have been shown to support digestion without disrupting stomach acid balance. If you or a loved one is currently taking PPIs, it's crucial to consult with a doctor before. Stopping the medication, as sudden discontinuation can cause acid rebound, worsening reflux symptoms. A gradual reduction under medical supervision is the safest approach. In some cases, H2 blockers, such as Pepcid or Zantac, or antacids, like Tums or Rolaids, may offer safer, short-term relief without the same risks as PPIs. Your brain health is just as important as your digestive health, and finding safer, natural ways to manage acid reflux can help protect your memory, focus, and cognitive function as you age. All would remember, small changes today can lead to a healthier brain and body for years to come. Pain relievers. Could your pain medication be harming your brain? Millions of seniors rely on pain relievers to manage chronic conditions like arthritis, back pain, and joint stiffness. The two most common types of pain medications are opioids and nonsteroidal anti-inflammatory drugs, NSAIDs. Opioids such as oxycodone, OxyContin, hydrocodone, Vicodin, and morphine are highly potent painkillers often prescribed after surgery or for severe chronic pain. NSAIDs, including ibuprofen, Advil, naproxen, Aleve, and aspirin, are available, over-the-counter and frequently used to reduce pain and inflammation. While these medications can provide relief, long-term use may come with serious consequences for brain health. One major concern is the effect of opioids on brain function. Opioids work by binding to pain receptors in the brain, reducing pain signals, and creating a feeling of relaxation. However, long-term opioid use can lead to brain inflammation, reduced oxygen flow to the brain, and even structural brain changes. Research published in the Annals of Neurology found that chronic opioid use was associated with an increased risk of cognitive impairment, including memory loss, confusion, and slower thinking speed. Additionally, opioids can cause drowsiness, dizziness, and poor coordination, increasing the risk of falls and injuries in seniors. NSAIDs, while considered less risky than opioids, also come with potential dangers for brain health. Some studies suggest that long-term use of NSAIDs can contribute to increased brain inflammation and, in some cases, higher dementia risk. Additionally, NSAIDs may negatively impact heart health, leading to poor circulation, which can, in turn, affect brain function. So what can seniors do to manage pain without putting their brain at risk? One of the best approaches is natural pain management techniques. Regular exercise, such as walking, swimming, or yoga, can help reduce joint pain and improve mobility. Heat therapy, warm compresses or heating pads, and cold therapy, ice packs, can provide relief for arthritis and muscle pain. Many seniors find that physical therapy, acupuncture, and massage therapy can significantly reduce pain without the need for medications. Diet also plays a crucial role in pain management. Foods rich in omega-3 fatty acids, found in salmon, walnuts, and flax seeds, have natural anti-inflammatory properties. Spices like turmeric, ginger, and cinnamon have been shown to reduce pain and inflammation naturally. Staying hydrated and maintaining a healthy weight can also help relieve stress on joints and muscles. If you are currently taking opioids or NSAIDs for chronic pain, it's essential to consult your doctor before making any changes. Lowering the dosage or switching to safer alternatives can help protect your brain from unnecessary damage. Remember, pain relief shouldn't come at the cost of your cognitive health. There are safer, natural ways to stay comfortable and pain-free, while protecting your memory and mental clarity. Dementia is a growing concern, especially for seniors, and while many factors contribute to cognitive decline, medications are often overlooked as a potential cause. As we've discussed, certain drugs like sleep aids, statins, antidepressants, antipsychotics, pain relievers, and more may increase the risk of memory loss and cognitive impairment. Some of these medications disrupt neurotransmitters, reduce essential nutrients, or contribute to brain inflammation, which can accelerate dementia symptoms. The good news? You have options. If you or a loved one are taking any of these medications, it's important not to panic, but to take action. Talk to your doctor about safer alternatives, whether it's adjusting the dosage, switching to a different medication, or exploring natural remedies and lifestyle changes. Simple steps like eating a brain-healthy diet, staying physically active, managing stress, and improving sleep naturally can make a significant difference in protecting your cognitive function. This is life-saving information, and more people need to hear it. If you found this video helpful, please share it with your friends and family. You never know who might be at risk. And now, we want to hear from you. Are you or someone you know taking any of these medications? Have you noticed any changes in memory or thinking? Let us know in the comments below. Before you go, don't forget to hit that like button if you found this information valuable. And if you want more tips on senior health, brain protection, and longevity, make sure to subscribe to our channel and turn on notifications so you never miss a video. Your brain health matters. Let's take care of it together.